Welcome to Module 6, which is Understanding Diabetes Medication. Diabetes drugs are divided into two main types, that is, insulin and oral agents. So, insulin is needed for people whose bodies do not make enough insulin, especially those with type 1 diabetes. And there are different types of insulin, such as rapid acting insulin, which is like it works quickly after a meal, usually like within 15 minutes. Short acting insulin, it takes a little longer time, but still it is going to act fast. Intermediate acting insulin, which lasts longer, covering about like a half a day. Long acting insulin works all day or even up to like 24 hours to keep your blood sugar stable. When it comes to the oral agent, it is mostly for people like who's having type 2 diabetes, and it helps you to lower the blood sugar level in different ways. So for example, you have metformin, which is the most common pill, and it helps to help the body to use insulin better. Then you have sulfonyl ureas, which is helping your pancreas to make more insulin. Then you have meglitinides, which is working similar but it acts faster. Then you have DPP-4 inhibitors, which helps the body to produce more insulin when needed. Then you have GLP-1 agonist, which is trying to slow down the digestion, and it reduces the appetite. And then you have the SGL2, which is inhibitor, which is also helping you to remove extra sugar from the urine. Right? Then you have acarbose, which is like slowing down the sugar absorption from the food. Then you have the TZDs, which will make the body more sensitive to insulin. So these are some of the types of the diabetes medication that can be used to control your blood sugar levels. What is insulin? Insulin is a hormone that helps the body to use the sugar, that's the glucose, for the energy. So when a person eats, their blood sugar will definitely rise, and insulin is going to help moving that sugar from the blood into the cells, as we have already discussed. People with diabetes either do not produce enough insulin or their bodies do not use it properly. That is why they require the insulin hormone separately. And because they do not produce enough insulin, what happens is it leads to high blood sugar level. So this is the reason they take insulin as a medicine. Here the image over here, it shows that how insulin is drawn into the syringe from a vial before it is injected into the body. This injection can actually help control the blood sugar levels and prevent the complication that is related to the diabetes. How to inject insulin? This has to be done with care of your physician, but this is just for your information. But whenever you are going to inject insulin, please take care that you are going to consult a physician, and then only you have to do it. So the left side over here, right, you can see here, this image shows you the best places that you can inject your insulin on the body. So these areas are divided into sections to rotate your injection sites, like, which means that you can change the spot each time to avoid the skin problem. The best areas are going to be like abdomen, which is your belly area, which is the most common and fastest absorbing site. Then you have your thighs, right, which is on the front side, which will have a slower absorption than the belly, but still it is like really effective. Then you have your arms, that is your upper outer side, which is which are like convenient spots, but it may be harder to reach alone. Then you have your buttocks, which is the upper part, which have the slowest absorption rate. Right? The arrows here are going to indicate that how to rotate between these spots over time to prevent like any lumps or skin irritation. Okay, the right side here, it is just trying to tell you the correct way that you can inject your insulin using a 90-degree angle. So the needle should always go into the subcutaneous layer, that is the fatty layer under your skin, which is there. You need to inject it on that, but make sure that it is not too deep into the muscle. So if, for example, by mistake, if the insulin is injected into the muscle, it can be absorbed very quickly and it can lead to hypoglycemia, or blood sugar fluctuations can also happen. So it is very important that you only inject it to the subcutaneous layer of your skin. So these are some of the different types of insulin. This is again just for your information. Insulin basically comes in different types based on how quickly you want it to work and how long it should last in your body. So we have rapid acting insulin. Okay, so this is going to work like quickly after injection, and it is usually taken like before your meals to control the blood sugar spikes. Then you have the long acting insulin, which is going to like take slowly, it works like slowly over a long period of time, which helps you to keep your blood sugar stable throughout the day and night. Then you have the pre-mix suspension, like for example, you have Humalog, Mix 50, Novo Mix. All of these are some of the examples. It is again like a combination of fast and long-acting insulin, which is making easier for people to manage the diabetes, like with having a fewer injection. So basically, what type of insulin your body needs depends totally on your doctor's advice. Never think that this would be a better option for me, because it totally depends on doctor's advice, that how your condition is and what is your sugar fluctuations, what is your treatment plan, what is your regimen. All of these will depend on uh, uh, you know the type of insulin that you've been using to control your blood sugar level.